Hello everyone, my name is Joseph and I'll be taking you through the introduction to pathology. So with this we are trying to know what is pathology, and when someone talks about pathology, what are they referring to or what do they mean? So the first thing that someone needs to know is the definition of pathology. So what is pathology? Pathology basically means the study of disease processes. Someone could say pathology is the study of the functional, biochemical, and structural changes due to disease. So it's disease that is going to change the functional, biochemical, and the structural changes of that particular cell or tissues. But remember, it all begins at the cellular level. So what is disease? Because we've seen that there is a change of functional biochemical composition due to disease, and now we need to know what disease is. Disease is any alteration in the physiological state of the body. Physiology is the normal functioning of the body. So any alteration in the physiological state of the body is disease. Someone else could say, in disease, it will involve the physical, biochemical, physiological, and psychological changes in the body and its surrounding. So that is what disease is. Now, some of the introductory concepts in the study of disease include, and these are very key for someone to know. First is etiology. When someone talks of etiology, they are basically referring to the cause of disease. Lesion. A lesion is basically an observable structural change due to disease, something that would appear if there is disease. If there is no disease, that thing is not there, probably, to some extent. When we talk of diagnosis, we are looking at a definite determination of the name, nature, cause of the disease. So you're looking at what's the disease, what's the nature of the disease, and what would be the cause of the disease. When we talk of morphological diagnosis, we are looking at the name of the nature of the lesion. Morphology, shape. What is the name of the lesion that has been formed? So that we can actually talk of, it's now a morphological diagnosis. Etiological diagnosis basically names the cause. Disease diagnosis, for it will name the disease. Lesion diagnosis, it's the same as the morphological diagnosis because we are looking at the nature of the lesion. Then we should understand what pathogenesis is. Pathogenesis is basically a process. First of all, you need to appreciate that. And we are looking at how it started. Genesis, if you're talking of Genesis, how the world started, just refer to the Bible. So pathogenesis refers to the process by which the disease develops from its initiation till recovery or death of an individual. So you're looking on how the disease has developed from the start to the end, and what is in the end, it's either recovery or death. Someone succumbs to the disease or they overpower the disease, and that is pathogenesis, the process by which the disease develops from its initiation till recovery or death of an individual. Prognosis basically refers to the forecast or prediction of a disease outcome. Now, prognosis can be categorized into three, or you can have three various prognosis. The first one, if there is a good prognosis, meaning there is certainty of recovery. You're suffering from malaria, you're going to recover. Prognosis could be bad, grave, or poor, and that means there is a hopeless situation. For example, as someone has a cancer or a tumor probably in the esophagus, and it is hard to operate to some extent, by all means you know that this person will not survive. Yes, so that is where we say the prognosis is bad. Then we have a guarded prognosis, that probably we've seen it, but now, there is hope, let's pray. So maybe someone would recover. We study pathology because of the various reasons, and these are the three major reasons. The first one is to determine the cause of the disease. The second one is to understand how the disease is caused. The third, if you've understood how the disease is caused, then we need to also understand how the body will respond to the disease-causing agents. These are all to guide us to the number one goal, which is to provide a perfect treatment, to know how to treat our client or patient. And that's the reason why we study pathology. When studying pathology, we use the various senses, except taste. So we use the eyes to observe, we use the hands to feel and understand the lesion, the nature to some extent. We use the smell also, but we never taste. So basically this is a cognition, as it's basically the senses of cognition. Under pathology, there are various contexts. For example, currently in year 2 we are doing the general pathology. Then later we shall have to do the systemic pathology in the advanced years, then the special pathology, surgical pathology. There is also the diagnostic pathology, anatomical pathology, clinical pathology, chemical pathology, and toxicological pathology. If we find pathology in the veterinary, then that would be called veterinary pathology. If it is in the medical field, then it's medical pathology. If it's in the zoo, then that would be called the zoo and wildlife pathology. Then what is general pathology? First of all, we understood what pathology means, where we were looking at the study of disease. Now, general pathology would also still be the study, because it's pathology we are learning. It's the study of the mechanisms underlying the disease process. So what are those things that are going to be below the disease process? How is the disease going to come about? With the common structural changes that affect all types of body systems. Now, this, to some extent, it has been generalized. The study of mechanisms underlying the disease process with the common structural changes which affect all types of body systems. So I think here you see that there is a component that is unifying all with the common structure changes which affect all types of body systems. So that is the meaning of pathology, general pathology. Now, some of the topics we are going to appreciate as we go through this topic of discussion, pathology, general pathology. First of all, we are going to understand the cause of disease, cell injury, necrosis, and somatic death, the disturbances of cell metabolism, the disturbances of cell growth, neoplasia, disturbances of circulation, and then we shall also see inflammation and repair. These are some of the textbooks that you can actually search out: pathological basis of veterinary diseases. That is one of the nice books, and then veterinary pathology, and those are the authors. Thank you very much. Yes, see you.